Hello, my name is Brianna Kazuki.
And I'm Jocelyn Smith.
Hello.
We're here to talk today about further education on multiple sclerosis. This should only take about 20 minutes.
So, what is your current understanding of your diagnosis? Can I clarify anything that your care provider mentioned earlier?
I understand that my body's attacking my own nerve cells, which causes the issues that I've been experiencing. I don't really understand the long-term effects of multiple sclerosis, or if I'm going to be like this forever, if I'll ever get over it.
Alright, well with MS, I'm sure that you know that there's no cure. However, we can manage your symptoms and prevent further disease progression through medication. I have a handout here that we can go over to review this disease.
So, first of all, what is it? So, this is a lifelong progressive autoimmune disease that attacks the covering of the nerve cells and causes widespread inflammation and difficulty sending nerve signals. The cause of the disease is currently unknown. So this is just a picture of where you may experience symptoms because of the nerve endings. So what does it look like? You may experience fatigue, depression, pain, weakness and numbness, muscle spasms, memory loss, mood swings, or an overactive bladder. And patients usually experience different symptoms based on where their nerve cells are affected. So some important things to know. Exercise such as walking, water aerobics, and biking can be beneficial to MS patients as long as they stop just before fatigue. It is important to avoid injury as it can worsen the disease, and following a strict medication regimen is vital in preventing progression of the disease. You should also ensure a balance between rest and exercise. So how do we treat it? We treat MS by treating the symptoms that occur. Other medications that reduce the disease progression are interferon beta, glutamate acetate, fingolimod, mixantrone, and methylprednisone. Okay, all right. So are there any cultural or religious restrictions that you have that you would like your healthcare providers to be aware of?
I don't think so.
Okay, and do you experience any reading impairments?
I have been experiencing some reading impairments just because my eyes have been really blurry and they also seem to move back and forth uncontrollably.
I would recommend that you follow up with your ophthalmologist about your blurred vision and your eye movements. Can you tell me a little bit about your daily life and how it looks?
So I drive 30 minutes to work each day. I work 8 hours and then I drive home. I try to do the household chores whenever I get home from work before going to one of my 3 kids' sports games or practices. And then on the evenings that we don't have sports, we try to go on a walk as a family. I attend church every week, and I'm also pretty active in the youth group there as well.
Well, I understand that you've taken on a lot of responsibilities, but it is important to balance rest and activity. You can maintain your physical condition by using range of movement exercises, which we will explain later. Walking, swimming, biking, and light resistance exercises. So, for instance, lifting light weights. I can recommend you to a physical therapist and occupational therapist, which will help you to maintain your current daily activities. It's important to maintain a healthy diet, and I understand that as it's easy to grab fast food, there are some healthier options that are just as quick and easy.
Do you have any questions for us about your physical health?
So what aspects are the physical and occupational therapists going to be helping me with? And what kind of foods should I try to eat? I have a really busy lifestyle. I have 3 kids under the age of 10, so I don't have a whole lot of time to do cooking, and I just never really feel up to it anymore.
PT and OT will work with your balance and coordination. They will have you participate in low-bearing exercises that will work on strength, like light weights, biking, swimming, active range of motion techniques. Like I mentioned earlier, these could be moving your arms, legs against gravity, or just side to side. And when it comes to foods, is there any specific foods that you do for quickness?
My family doesn't have a lot of time, and like I said, I haven't really been feeling up to anything lately. So we take a lot of McDonald's runs or any other fast food, really.
Okay, well, here are a few options that you can pick from that will help your health and hopefully fit your busy lifestyle. There's eggs, yogurt, milk, tuna, and then deli sandwiches with like the cheese slices. orange juice, fortified cereals like Special K, and cornflakes.
That doesn't sound too bad. I'll do my best to incorporate them into my diet.
Now, how are you coping?
This is all really new and hard to understand. My life is already stressful enough as it is, and now I'm having to handle this as well, so I would say I'm not coping super great.
Well, I understand that your condition can become stressful and hard to handle. So who's your biggest support system?
I would say my family is my biggest support system, specifically my husband. He already does so much for me and for our family.
Leaning on others in your life is important, especially to be able to balance activity and rest and avoid flare-ups in your disease.
Now, how do you relieve stress?
Like I said, I'm really active in church and the youth group. I also really enjoy spending time out with my friends. I just haven't had the energy lately and haven't felt good enough to be able to go.
Well, it's important to keep your stress at an appropriate level because this can actually be a trigger for MS. I would recommend that you join a support group for your condition, and you can find a local support group through the National Multiple Sclerosis Society website.
Let's talk a little bit about medications. How are you handling that financially?
I have a pretty big family, and I'm not sure how we're going to afford everything that we already have to afford on top of the doctor's appointments and all the medications that I'm going to need. We currently have a deductible of $3,500, and then the insurance company pays 80% of the rest of the medical expenses.
Well, we can actually have you meet with a social worker to discuss these expenses.
Before we talk about meds, I want you to understand and get the most out of these teachings. Is there a certain way that you learn better, for example, handouts or us actually showing you certain techniques? And do you think there's an individual that would benefit from hearing all these information?
I'm a pretty hands-on learner. If there's anything that I have to do for myself, I feel like I would learn best by being shown. And I'm going to do my best to handle my medications all by myself.
Okay. Well, your first medication is interferon beta 1A. This typically runs around $8,600 for 12 syringes, which is a 1-month supply. So it's used to slow the disease progression, and it's given subcutaneously every other day. So to do that, there's different sites for injection. So you can use the outer hips or thighs, the upper hip area, the outer and upper area of your arm, or the abdomen. And you want to switch off sites every time you inject. So if you give it on the right side, move it to the left for the next time. And this medication can cause flu-like symptoms, so it can be taken in the evening with acetaminophen to help sleep off the side effects.
Okay, so why do I have to switch the sites? Because I feel like if I'm going to be handling my own medications, it would be easier to just give it on my abdomen every time.
Well, that's a good question. When you keep giving injections in the same spot, your body will form a tough tissue, kind of like scar tissue, and it will affect the absorption of medication, so would it help in the long run for you? Okay. All right, so then we have Varipril, which runs around $12 for 90 tablets. It is used to lower blood pressure and reduce your chest pain. And your dose is 240 milligrams, and you take it by mouth in the morning. It causes hypotension, bradycardia, and can cause heart failure.
What does hypotension and bradycardia mean?
So hypotension is when you have a low blood pressure, which can cause like dizziness and just fainting spells in a way. And bradycardia is when your heart doesn't push as much blood and everything to your body, so it's a low pulse. One way to monitor that, I would recommend getting a home automated blood pressure cuff to keep an eye on that.
Alright. And then we also have tizanidine, which typically runs for $25 for 180 tablets. This is a muscle relaxant to help reduce the muscle spasms you've been experiencing. You mentioned the restless leg syndrome in your assessment. Your dose is 2 milligrams by mouth twice a day. This can cause hypotension, bradycardia, and dizziness, so like we mentioned, using an automated blood pressure cuff is useful.
Alright, and now we have clorazepam, It is $25 for 125 tablets. It's an anticonvulsant medication that will help with nerve pain, spasms, and tremors. You will take 4 1 milligram tablets by mouth before bed, and this can cause respiratory depression, leukopenia, and weakness.
What does leukopenia mean?
Leukopenia is when you have like a low white blood cell count, and we can set up regular testing to monitor that.
All right, and then we have venlafaxine, which typically runs around $40 for 180 capsules. It's used to treat depression. The dosage is 75 milligrams by mouth every night before bed. Some side effects can be suicidal behavior, increased urinary frequency, and insomnia. So if you start to experience any of these symptoms, make sure you call your provider right away.
All right, and then next we have propranolol. It's $7 for 180 tablets. It's used to treat muscle spasms. You will have a dose of 2 milligrams twice by mouth, and this can cause orthostatic hypotension, dizziness, and chest pain.
What is orthostatic hypotension?
Orthostatic hypotension is kind of the same as normal hypotension. It's where you kind of sit in one position and your blood will pool, and when you get up, you can be dizzy or faint. So we can avoid this by dangling your feet over the bed before getting up or standing up slowly.
All right, so then we have gabapentin, which typically runs for $20 for 120 capsules. It's used to treat muscle tremors and nerve pain. Your dosage is 300 milligrams twice a day by mouth, and it can cause nystagmus, leukopenia, and depression. And nystagmus is the uncontrolled eye movements that you have been experiencing.
All right, and then the next medication we have is amantadine. Sorry, can't pronounce it, but it's $40 for 90 tablets used to relieve fatigue. Your dose will be 100 milligrams twice a day, and it can cause cataracts, depression, and heart failure. And with this, we will make sure to set up follow-up eye exams.
All right, and then we have some iron supplements that are beneficial for healthy neurological movements. Working. All right, and then we have calcium and vitamin D, which support healthy bones because MS can actually cause osteoporosis. And then lastly, we have a multivitamin because this is used to decrease inflammation and fatigue.
All right, so I know that's a lot of information we just thrown at you. Do you have any questions for us as of right now?
I think I can handle all the ones that are just normal by mouth, but can you walk me through how to give myself an injection because I've never done that before?
Yes, I apologize for not going over that earlier. So first of all, you want to gather your supplies. So you want to make sure that you have an alcohol swab, the needle, and then the syringe dosage that should already be to the correct dosage. And then there's different sites that you can apply this to. So there's
I think we talked about the sites.
Okay.
But how do I actually do it?
All right. So you want to take your hand like this, and you want to squeeze the site so you get like a little fat area, and then you stick it in at a 45 to 90 degree angle and inject the medicine.
Okay, so I clean it first with the alcohol,
Yes.
and then gather the skin, and then insert the needle at a 45 to 90 degree angle.
Yes, and you want to make sure to let the alcohol dry before you inject.
Okay. And then my other question is, this is a very long list of medications. Will I be on these medications for the rest of my life?
Well, these medications may change over time. Some of them may stay the same, but you will typically be on a lot of medications just to control the disease and to slow the progression of the disease.
Okay. When should I come back next time to review everything and go over as a checkup?
Well, we ask that you come back in 3 months to make sure everything's going good and your medication is good.
And I'm good.
All right.
Do you have any other questions for us?
No.
All right. Well, thank you. All right, so gabapentin typically runs for $20 for 120 capsules. It's used to treat Alright, so then you have gabapentin, which typically runs for $20 for 100 capsules.
I'm going to kill you!